Hi, I'm Dr. Bada with the Howard County Health Department, and I'm here with my panel guests to talk about maternal health during Black Maternal Health Week. This is a roundtable discussion, and it's an opportunity to provide continued awareness of the Black maternal health movement. Black Maternal Health Week was a campaign founded and led by Black Mamas Matter Alliance. It's a week of awareness, activism, and community building with the intention of centering the voices of Black mothers, women, family, and stakeholders, enhance community organizing on Black maternal health, deepen the national conversation about Black maternal health in the United States, amplify community-driven policy, research, and care solutions, and provide a platform for Black-led entities and efforts on maternal health, birth, and reproductive justice. Last year, April 13th in 2021, the White House recognized Black Maternal Health Week. And so we are here to discuss one of the determinants of the crisis, which is healthcare access. We want to particularly focus on the prenatal care delivery care model. Prenatal care delivery is usually centered on the provider-patient model. However, studies have shown that better outcomes can be achieved by expanding this model of care and embracing a community-based model. This community-based model includes centering providers, midwives, doulas, and lactation specialists, and other care coordinators. Our goal during this week is to dialogue with one another and answer questions from the community about the benefits of community prenatal and postpartum care. We all know the statistics where Black women are 2 to 3 times more likely to die during childbirth than their other racial counterparts. Black women also have a high preterm delivery rate, about 44% higher than the rate among all other women. But I really want to use this opportunity to really talk about how we can diversify the way in which we deliver care. So I want to start by introducing our panelists. And so we'll go around and start with Astasia, who is a centering provider. Can you introduce yourself and tell us how you came to do this work?
Yes. So my name's Astasia Lacey. I'm a family nurse practitioner. And directly, I'll go back. When I was a registered nurse, I worked in labor and delivery for about 5 or 6 years and, thought about becoming a midwife and then ended up doing the family route. And I spent a lot of time in private practice, OBGYN, dabbled in a little bit of pediatrics, and have now found myself for the last 3 years now as the maternal and child health director at CCI Health Services. And that role includes just kind of overseeing the centering parenting, which is group pediatric care, and the centering pregnancy model of care that we have at our office.
Oh, thank you so much for telling us that. Next, we'll talk to Ebony.
Hi, my name is Ebony Simpson. I'm a full scope certified nurse midwife at Birth Care and Women's Health. It is a freestanding birth center based in Alexandria, Virginia, that's been around in existence for 35 years. Black woman owned, founded, owned, and operated. Marsha Jackson, Howard University alum. We provide home birth services in the DC metro area, so that includes Virginia, Maryland, and DC, and we also do birth center births as well. Our mix is about 75% home birth, 25% birth center birth. I've been with them now for about 2 years. I worked for a year as a birth assistant just to get more familiar with out-of-hospital birth, and I joined the staff full-time in September. Before that, I worked in hospital-based maternity care services. I spent 5 years at the Washington Hospital Center, MedStar, rotating as a nurse through labor and delivery, postpartum care, antenatal care, and the special care nursery. My story is a little interesting. My plan was always to be an OBGYN since I was about 11 years old. Went into pre-med, got some, experience after graduation, ended up having my daughter with a midwife at a birthing center based in Brooklyn called the Brooklyn Birthing Center, and had such a phenomenal experience that seemed to be very different from what a lot of the people in my community was having, that I decided to totally switch gears, go back to school, become a nurse, and become a midwife. And it's been a great experience. What we offer is a lot different than what, the average woman experiences in a hospital setting. It's very much focused on personalized care, family-centered care, and really developing relationships with our clients. And we have really, really, really great outcomes, if I could say so myself. So looking forward to talking more about, what we do and how our model of care, I think, can make a huge impact in, maternal mortality stats and just improving maternity care.
Oh, thank you so much, Ebony, for that. I was like, I appreciate the Howard shout out since I'm also a fellow Howard grad.
Same here.
Right? Yeah. All right, Allison, thank you. Tell us for what do you do and what brought you to this work?
Hello. So glad to be here among amazing women doing amazing things. I am a doula. My name is Allison Stewart, and I run Let's Doula This LLC. I also work with the Maryland State Doulas, and after being a teacher, mostly preschool, for about 20 years, I had my daughter, and my mind just couldn't leave being a doula alone. I just kept coming back to it. I kept thinking of the village and how we need support. I had been that support for a lot of families, being a teacher for about 20 years almost, with a lot of mine experience in the primary child from 0 to 5. And that is such an important age to me. I still haven't left it behind. So I incorporate a lot of educational and STEM ideas, helping parents into my work as well. I believe that doulas are helpful for the family because one person's life isn't just changed with this new little person coming into the world. Um, the birthing person's life changes, but the whole family's life changes. So I consider it to be a huge honor to be invited into that intimate space. I've been lucky enough, even through COVID, to be able to be there to welcome babies into the world, and help prepare their parents and their siblings to welcome them in. I have also seen the postpartum side where I feel that's where that support is essential. It's very hard to feel connected to the world when your whole world is centered around someone little who needs you for everything. So I feel like the work that we're doing, the work that we're discussing it's crucial. And especially going through a pandemic, that changes the dynamic a lot. So I think what we're doing is necessary and this conversation is necessary. So I'm so excited to be here. Thank you so much.
Oh, no, thank you for taking the time to talk to us today. And then last but not least, we have Bookie. Tell us what you do and what brought you into this work.
Good morning and thanks for having me here. So my name is Oluwabukola Demiloye. I'm the lactation consultant at the Howard County WIC program in the Howard County Health Department. So my journey started way back in Nigeria when I had my first daughter. Then I was doing my pediatric posting during my med school years. So, being a student, my husband came, my husband has always been here. So he came with all the nice things and all the food for the baby. So I think my journey to breastfeeding started as a determination to do what a man could not do, because I felt the man did everything he could for the child and, student. I had nothing to offer. So I decided to breastfeed. So, I didn't really get the family support or the partner support at that time because it felt, my studies was more important. That was defiant because I saw that it was working for my baby. And my daughter was exemplifying all the wonderful milestones that were expected for a child, which I was learning in school. So my daughter became like the lab rat for my co-students because everything we learned that was supposed to be normal in a child, everybody wanted to check it on Oluwaseun. That's my first daughter. So it was beautiful. She grew very well. She's tried very well. So for my subsequent deliveries, when I came here, it was a no-brainer for me. So for my journey to WIC, I was home with my children when I, came over here to America. I had, I had some challenges here then. So staying at home, I wanted a way to give back to the community, to participate, to share my experience and my knowledge. So I found out about the WIC program. So I started here as a breastfeeding peer counselor, working just part-time. But because of my background in, my health background, I wanted to do something more. I wanted to learn more, gain more expertise to be able to do much more for mothers. And I feel WIC is just that appropriate place where you're going to meet the mothers, you're going to meet the babies and meet them at the points of their needs. And the most important thing we do is to provide information and education so as to empower those mothers to make their own informed decision to nurture their children in the right way. So thank you very much for having me.
No, thank you so much, Boogie, for participating in this panel today. All right, so we're just going to jump right into it. And I want to start first with Astasia. So centering is not necessarily new, but there's been a lot of attention towards like looking outside that typical office for building kind of prenatal care where you're seeing a doctor and you're seeing the patient. And so I want you to tell us a little bit more about what is centering, is it available to everyone, and what does an average centering visit look like?
Yes, definitely. So I'll first say I love centering. Like if you have not experienced it, just as a provider, from a provider perspective, it breaks up the monotony and the routine of the visits, and you're really able to have fun with your patients. You're able to connect with them on a different level than I think you do in regular office visits. So like you said, it's been around for a little while. I didn't know anything about it prior to the role, but had always had a love for maternal health and pediatrics. And, you know, the role actually that I'm in right now was created for me. I had applied for a different role. And once I kind of told them my passion, they were like, hey, this is what we have. We kind of need you to push this program. So definitely once hearing it, I was really excited. I was like, oh, I've never heard of this before. I didn't even know that's something that we can do. So what changes or what centering is about, it's a model of care, and it is a group model of care for prenatal care. So it breaks up, like I said, the routine visits, what you're doing, and each office is a little bit different. So I'll kind of tell you how our office does it. We break our groups or our cohorts, what we call it, into sessions, and we book them by the due date. And so each mom, if you're due in May, you'll be in a group with moms that are due in May. If you're due in June, and so on and so forth. Some organizations I have heard they'll group, you know, if you have a very diverse population, they will have an African American maternal group, they'll have a Hispanic group, they will have a refugee group, just based on the different languages, to provide some cohesiveness. And those visits are anywhere from 9 to 10 sessions. So we follow them starting at about 12 to 16 weeks or so. That's when that first session starts. And then it follows the regular routine prenatal schedule. So we see them every 2 weeks for the first few months, and then we start to see them every 4 weeks, and then every 2 weeks thereafter. And they usually end at about 36 to 37 weeks, where we kind of send them off to continue to do their weekly visits with us, and hopefully feeling very prepared. The visits are different. So you still get a little your prenatal care from your provider. It's an intimate setting. We have, I wish I could show you guys the room. We have a very large room with rocking chairs. It's a beautiful room. And then we have a small, private, intimate space kind of off to the side with the exam table, our gel, for us to be able to do our belly checks and kind of have our private conversations with the patient. And I just want to point out that piece because I know some providers are like, well, how do you address issues with the patient when you got to go to this group? And so for us, a lot of times, a lot of the issues that the moms raise up, all the other women have that same concern. So they're like, I'm having back pain, or, you know, my hips are hurting. And so what I usually do is say, okay, let's bring that to the group and let's talk about what the other moms might have to say about that, or what other things they may say that may be helpful. That's for about an hour where we do those belly checks, and then we do what's called circle up time. And so it's literally just that. It's a circle that we're sitting in. And this is where we are doing activities. We normally do an opener. And that is really kind of like an icebreaker for the moms. You can really make it how you want to. The Centering Institute is really great with offering a lot of helpful resources and guides to structure it how you want. but you can also go outside of that. So sometimes I'll play games that are not even in the book to kind of help the moms get to know each other. And then we kind of get in the meat and bones of everything during the circle up time where we talk about different topics. So that includes nutrition, that includes dental, behavioral health topics, postpartum depression, domestic violence, breastfeeding. I mean, anything that you can think pregnancy related, we talk about it. Labor. And what I love about CCI is that we are a federally qualified health center, and we have different departments, different services. So when I came on, we integrated those services into centering. So our nutritionist or our dietitian, she comes and attends the session. She does a full activity with the participants. We do birthing ball exercises. And we also have behavioral health come in who does our postpartum depression discussion. We are currently trying to get doulas into our centering model as well, to kind of help with doing some labor sessions. So if you guys are interested, definitely let me know. So that's what a typical visit kind of looks like. We close it out at the end with meditation, one of my favorite things that I love doing. We do gratitude, and the moms then are, allowed to leave after that. So the sessions are about 2 hours long. First the belly check, and then you have the circle up time. And like I said, they're with us till about 36 to 37 weeks, where they go back to their routine visits.
Oh, wow. Like I knew about centering, but I was like, this is, and I really love that it's centered on the idea of community, like the fact that you have everything kind of like in a circle, and then there's an opportunity to kind of diversify in how you want to deliver centering. And so, oh my God, that was great. But that kind of is a nice segue into like the questions I have for Ebony and the idea of community and the idea of the midwife role in Black communities. Like this is not a new thing. There's a lot of historical context in terms of like granny midwives and its role that it played in Black communities before the introduction of a more centralized prenatal care. So can you provide some like historical context about midwives and community colors, and like what are some misconceptions about midwifery care? And then also what are some of the high points of midwifery care?
Yeah. Well, I think you said it really well, Dr. Bada. When we came to this country as enslaved individuals, we brought over a lot of the skills and the knowledge of, how to take care of women in pregnancy, birth, and beyond. And those skills were utilized. They were utilized not only in our own communities, but we took care of our enslavers, wives and when they were giving birth. So it's a centuries old tradition of Black women, granny midwives serving the whole of, early United States. It was very common, even up until maybe about the 40s or 50s, for people to be giving birth in, especially in the South, at home with a midwife. And they took very good care of the women. For one, the ratios were not that high. So you're serving your community as a granny midwife. There's only so many people that you're serving, so you're able to give that one-on-one attention. And then there's the familiarity. So your mom probably also, her birth was attended by the same midwife, and possibly the midwife who even attended her birth was the same individual. So it's already that comfort level of knowing, this person knows me, they know my family, they know my culture, and so I can relax and you can build that rapport. Unfortunately, what ended up changing the way maternity care was delivered was the introduction of, the modern physician, OBGYN. There was in the 50s, 60s, a whole smear campaign essentially to basically depict these granny midwives as dirty, uneducated, not worthy to do the job. And the reason for that was to basically, gain control, over this process. And and move it out of the community into these centralized hospital facilities, which, definitely serve a purpose, right? I'm all about, having that kind of care because sometimes it is needed. But we know at this point that birth has become very much, over medicalized. There are too many interventions. The amount of people that are having, C-sections is way higher than what's needed. And it comes from, taking individuals away from their family, outside of their community, putting them in these hospital systems with people who don't know their culture, who don't understand where they've come from. And now they're trying to take care of them in the most intimate time, at the most vulnerable time of a woman's life. It's just, not really sensical when you really break it down. And so what we're finding is, like I already mentioned, 30% or more, depending on where you live, rate of C-sections and, the Black maternal mortality health crisis. We know that whenever, we're suffering as a collective, Black women are always suffering more, So this is a larger problem, but it's even more amplified in the Black community. So one of the things that, what makes our care so great is that, we have 5 midwives and we all live in different areas. Some are in PG County, some are in Montgomery County, some are in Fairfax, I'm in DC, and we see clients all over. And while all of our clients are able to meet with each of us, they're also able to say, you know what, I'm really gelling with Ebony, or I'm really gelling with Whitney or Martha or Dorothy or Marsha. I want to do more of my visits, with that person. And then we even can sometimes what we call special people, which is, when they go into labor, even if we're not on call, then we, have the option to attend that birth. So we can kind of have that continuity. And the beautiful thing is, we see clients, I just got to the client, but Marsha, we recently had a very interesting birth because, as you know, Marsha Jackson, the co-founder and current director, is a Howard alum. She delivered that client's mother. She attended that client's birth, right? The mom was a Howard alum, and then the client herself was a Howard alum. So we had 3 generations now, 2 generations, the mother, the grandmother, and now we had this baby, and Marsha was involved in their birth. So how often, do you have that kind of experience? So I think that, to answer your question directly, this is what we need to go back to. We need to go back to that personalized, family-centered care. Because, birth, yes, it is inherent with risks, right? But when you're dealing with a low-risk population, healthy mom, healthy baby, the chances are things are gonna go well. So long as you have a skilled attendant that has a good relationship, there's good communication, there's good follow-up, and all of that can be achieved just as well in the community, in the home setting, in the birth care setting, in the birth center setting. And so where we need to go now as a community is to really bring out-of-hospital providers into the framework as a permanent piece of how we deliver maternal services, so that when things do go awry, we have smooth transitions where out-of-hospital clients are accepted and there's communication between in-hospital and out-of-hospital so that we keep everyone safe.
Oh, that was so great, Ebony. One of the things that you brought up about gelling with, a certain midwife is this idea of advocacy and being able to speak up and say, this is the provider I'm finding that I'm relating to a little bit more. I especially love the part about another generation of Howard, probably a student being born, but just to ride that advocacy wave and talk about doulas. My first introduction to doula care was definitely when I was in New York. I did my training in Brooklyn. And so that was my first introduction into a doula. And I found that they really worked as advocates, but I really want the expert to kind of talk a little bit more about what is doula care, what does that support look like, and how long do you typically work with a family during that pregnancy journey?
So anywhere between finding out you're pregnant or up until your due date, you can probably get your doula on board. Working with an agency, you can interview with different doulas, and it may take you a minute to find the doula that you gel with, and find the one who you feel best gets you, best understands your care and what you're really looking for, that type of support. And I feel like that's the big word that keeps coming up, support. And everything that we've talked about, it just keeps coming up because that's what we need and that's what we do in those intimate moments. Um, Being able to support your client in a way that they feel comfortable, whether it is at 36 weeks, whether it is at 14 weeks, whether it is in the middle of a labor. I've had clients say to me, my ideal birth is that I make it out. I make it out alive. Everyone is happy, safe, and healthy and whole. And I always let them know that while legally I can't speak for you, I can say, especially knowing what you want in a birth plan. Um, we've talked through the things that you want. We've talked through the things that are your concern. What happens when you get into a nervous situation? How do you handle stress? Because as we know, birth can bring on a lot of feelings. It can bring on happiness. It can bring on tears of joy. It can also bring on nausea. It can bring on fear. It can, and a lot of our moms are told, oh, it's going to hurt. Think about the fear of it. But they forget they've been through hard things before. And so one of our jobs as a doula is to help them kind of navigate and get over that hump of fear. I often tell my clients, you've been through hard things before, and on the other side of it was a new start, was a new thing. So you'll push through this pain, but on the other side is your baby. There's something good waiting for you on the other side. And I think that part of being a doula is giving them the tools, the information, the education. And a lot of doulas talk about empowerment. Just letting them know that A, you're not alone. B, I can't speak for you, but I'm going to ask, is there anything else that you need to know? Are there any other questions? I'm an advocate for asking questions. We are a part of your team, not the other way around. You ask those questions as much and as honestly and as bluntly as possible until you get the answer that you feel comfortable with. It is such an intimate moment and such a intimate space to be into that there's a sacredness there. And I think a doula can bring peace. I had a client call me and she felt like she wasn't in control of her decisions. Well, the minute I walked in, her husband said to me, you helped to calm it all down. She needed you in that moment. And the fact that just having that support, that community support, gives you a chance to have that peace in the middle of a moment that is hectic and exciting and overwhelming at times. The support can look like registry advice. It can look like parenting advice. It can look like labor and delivery and postpartum support, can be anything. I had a mother who, after having her children, she realized she couldn't touch her feet. She got out of the shower and said, I can't touch my feet. Oh my goodness, I forgot. I haven't seen them in a few months. And so it was me on my hands and knees, drying her feet. And it's a humbling, I'm very humbled to be in that sacred space. So it gives you another chance to have that personalized care. Everyone always looks after the baby. There's going to be 100 people that look after the baby. But who's looking after mom? Who's looking after dad? Who's making sure that, you have the things you need when you come home? Because the last thing you want is to have to go to the store after just having a baby. There's so many other things going on. And having that lactation support, having that community support, and those resources, whether you need a different doctor, you need a specialist, you need certain things, doulas can provide those resources. And I feel like we're the connectors. But it can be a personalized support of however it is that you need to flow and you need to move in a comfortable, supportive way.
Oh, wow. I need a doula.
A life doula.
I'm gonna need to book you right now.
Like a life coach. I'm a life coach for doulas. Let's do it, guys. Let's do it.
Sometimes it's that desire to like fellowship, that like
Yes.
that I think like that we're all bringing to the table in a way that often is like left out of maternity care. And I thank you for that. Bookie, I want to talk to you because like one of the things you talked about, especially as Allison was talking about postpartum care and like the help, and oftentimes you had mentioned in your story about how your husband came and brought all the stuff, and oftentimes there's such an excess of like formula and like other sources to help nourish the baby, and then like I just feel like there's an opportunity for you to speak more about what are some of the benefits of breastfeeding, what are common misconceptions, and how can we as the family, like the support, like your sister, your spouse, your partner, can kind of bring in to help support a mother who wants to breastfeed or who's on the fence about breastfeeding.
Thank you very much. So breastfeeding is just the perfect food. And it's so beautiful in that it's not just good for the baby, it's good for the mother, and it's good for the family and the entire world. I don't think there's any food that offers that much. So over where I work at WIC, our goal is just to ensure that our mothers receive all the education they need regarding breastfeeding. So they make their own informed decision as to whether to breastfeed or not. And if they do so, our goal is to support their breastfeeding efforts in all ways possible. We still have some mothers who decide to sit on the fence regarding breastfeeding. But at the end of the day, like I always tell moms, it is still your baby. Whatever decision you make, we are going to support you and we will never, judge you or castigate you. So breastfeeding, when you look at the baby side, there's really nothing as nice as having a happy baby. So breastfed babies are happier babies. They know their source of nourishment from day one. So maybe that explains the bonding that they have, the very close connection they have with their moms. There's this common saying I always use whenever I give classes. So I tell some moms, there's nothing as good as knowing as a mom that your child will not eat if you are not present. Those babies who are fed, in an alternative way, anybody can do it. So they might not really care. But, for a child to know that, okay, my mom goes out of that room, she has to come back because she has to feed me. That's very special. Breastfed babies, they have a whole lot of immunity because the colostrum that is the first breast milk that comes out is packed with immune supporting materials. So that boosts so that's just like their first vaccination from the get-go. And it also helps, it has this laxative effect that helps them expel the meconium they've gotten from the moms. So that's just the colostrum part. And when you now look at the entire whole milk itself, the full matured milk when it comes in, is rich in nutrients. It has hormones that support every part of our life. Like it has things like insulin. We all know what insulin does to the body. It has things like erythropoietin that helps red blood cell production. It's rich in vitamins. So, we know our vitamins. Vitamin A is very important for our sight. Vitamin E is an important antioxidant. Vitamin B12 is necessary for our nervous system development. Breast milk has all that. It even has enzymes that digest all forms of food, the proteins, the lipids, the starches we eat. It has immune fighting materials. It has immunoglobulins. So the IgA coats the intestine of the baby, so they have less diarrhea and all these other diseases. They're healthier. So, and these are just a little bit of some of the things that are just in breast milk. So anything you find in common food, your breast milk has it. And most importantly, I think breast milk is still that food that is almost 100% utilized. Research says it's 95% utilized. I think that's still a lot for something that is ingested in the body. So there's less waste. So the babies are healthier. Research has shown that they have a higher IQ, which is, I think we all want our babies to be smarter. And that is just looking at just a little bit of the benefits of breastfeeding to the baby. But when you now look at it as a mom, because I always love ourselves not to be selfish. We want to take care of ourselves as mothers. We give so much to everybody. We also have to look out for ourselves. So like we always say in our classes, if you don't do it for the baby, do it for yourself. You deserve to be taken care of too. Anything that will protect you from, from having less bleeding after birth, I think it's worth doing. Anything that will reduce your risk of having some cancers like, uterine cancer, breast cancer, ovarian cancer, I think I'll do it for myself. So, and also the mere fact that it is very convenient, especially when you think of breastfeeding at night. You don't need to wake up from your bed to mix, things together, wash the bottle and stuff like that. You just have to have your baby and, and you guys do your thing. So when you look at it generally like that, as a mom, going back to work is easier, and the government has really made it very wonderful for us with the Obamacare Act that was part, the Breastfeeding Act, that you can even go to work and be able to pump your milk, and your employer, in as much as they have a certain number of employees, they can give you a room to pump your milk outside the bathroom. Everybody wants that. That is a huge step from where we were many, many years ago. So with that, I think our mothers should look up to breastfeeding as not just good for my baby, but good for me. But when you now look at it on the family side, it provides this wonderful bond for families. Fathers are there to support by assisting mothers in household tasks. Aunties, uncles, grandmas, and grandpas, they can sing for the babies. They can help with, playtime for the babies, dappering the baby, and all sorts of things like that. So over here at WIC, what we basically do when a mother comes in pregnant, we love to catch them early. And that is why we always say all those referrals, we want them. So when they come early in the pregnancy, we provide breastfeeding education. So we explain to them what is expected. Will you like to breastfeed? What are the benefits of breastfeeding? Then as the pregnancy advances, we follow them every month. As the pregnancy advances, we talk of breastfeeding and nutrition. We talk of going back to work. We just prepare them in general for when that baby is going to be here. And one thing we always encourage is for them to have their partners, or maybe someone who is going to be their advocate. It could be the grandmother, it could be the husband, it could be the sister. So in case anything happens during the delivery process, her mom is not able to really speak up for herself, that advocate could really speak up for mom and be like, okay, we really want this baby breastfed. We need a lactation consultant, or any way you could help the mom foster her breastfeeding decision. And that is one of those things we also do for them in the clinic. And also when they now have the babies, they bring the babies back to us. We keep on weighing the babies, making sure breastfeeding is good, everything is working well, baby is growing well. And for those people who, because baby came early, there's some health issues, that is why we have the lactation consultants in the house. We refer appropriately if it's, there's a nutritional need or there's a nutritional risk. But if the risk just has to do with breastfeeding, we address it and refer to the providers in the community that will assist appropriately. And another thing we also will do when moms are going to work, we have this full support for those going to work if they need an employment, employer letter. So if, for example, the employment is like a very small workforce and they really want to pump their milk while at work, they're scared to talk to the employers. So we provide letters that they can take to the employers, explaining to them why it is very good for the employment to support that mother's decision to breastfeed, because she's going to be able to be, she's going to give back more to the to the company or to the employment place, because she's going to take time off, less time off work just to be going for doctor's appointment, because breastfed babies are healthier. So your baby is not going to be visiting the doctor all the time. So mom is not going to be using sick leave from time to time and so on. And we really found it to be a very successful thing, because we've seen a lot of places where you will not even imagine a breastfeeding mom to be. We've really seen them embrace breastfeeding and support mothers to breastfeed. Places like even Costco, even McDonald's, where you would think, oh, how can I work in McDonald's and breastfeed? Oh, yes, they do, and they pump their milk too. And when you now look generally at misconceptions about breastfeeding, a lot of people, so it takes me back to the employment too. A lot of people feel when mothers are working low-income jobs, breastfeeding is not meant for me, because, there's no how I can maintain a job of $15, $20 an hour and be able to look up to my employer and tell them I want to pump my milk. But hey, that's just a misconception. We have a law in place to protect mothers now. And also Black women, we love our bodies so much because we are so beautiful. So for a lot of moms, they feel breastfeeding makes their breasts sag. But we are here to let them know that breastfeeding is not what causes the breast to sag. It's the pregnancy, it's the hormones of pregnancy. So wearing a supportive bra can really be good. So breastfeeding doesn't let you lose your grace. It doesn't let you lose your beauty. We are always going to be beautiful, irrespective of whether we breastfeed or not. And I think lastly, I'll just say, a breastfeeding woman, a lot of times they believe she has to conform to certain diets, to breastfeed. And we always let moms know you can eat whatever you're comfortable eating, in as much as there's no allergy and there's no risk to the child or the environment, and breastfeeding will just be fine.
Oh, thank you so much. You had so much power in your talk. I hope that we were able to convince anyone who's on the fence to breastfeed, but I also appreciate you offering space through WIT to say that if that's not the decision that you want to go to, we're here to support you as well. And so I appreciate you for extending that grace and that space to women who decide not to, but to also talk about the benefits of breastfeeding. So we're kind of at the end of our talk, and I just kind of wanted to wrap some stuff up. And I just wanted to, like, again, appreciate everyone who's here, but wanted to see if there's any last parting words that our panelists had to offer in terms of anything that's missing from this conversation about Black maternal health and things that we can do from a public health standpoint in terms of improving outcomes. And we can start with Astasia. Oh,
Sorry, I had to unmute myself.
yeah.
Yeah, so what I'll leave off, I know I talked about centering and the model, but I think a lot of people probably would wonder, like, what does centering do for Black maternal health? And so it has been shown and a proven model of care to decrease health disparities, not just amongst all women, but significantly reduce those health disparities in Black women particularly. And some of those health disparities is lowering the risk of preterm birth. Our site, even through COVID, we're in PG County. And so PG County for Black women, I think in 2021 was 8.1 or 9.8%, I can't remember. And we were down at our lowest that we've been at all time of 3.3% of low or preterm birth rates. That's the same for our low birth weight as well. You have a higher increase of breastfeeding rates. And that support, we all said at some point during our conversation that support is so significant. And how I kind of look at it as, we have our life as moms, as women, it's so multifaceted. We are in so many roles. We have so many things going on. We're oftentimes the support of our family, our extended family. We have jobs. We oftentimes are having so many people that are dependent on us. And I really think that centering allows the ability to unload some of those things and be able to really bond with other women that are going through the same thing. And it can really feel like you're isolated. I wish during both of my pregnancies I knew about centering. I was a little bit younger, and the visits, they're so routine and so rushed sometimes, not even purposely. It's, our schedules are packed. We're trying to get patients seen. We're trying to get them out the door. And, as a mom before, you don't know what questions to ask. You're going into the visit and you're like, okay, and get seen, and not really being well informed about breastfeeding and why it's important. You're not told, or talked at length about that until after you deliver. And, you got so much stuff going on. You got this new baby here, your body, you're getting used to the adjustment and transition of just having a baby. And so the stress of trying to learn all this information about breastfeeding can be overwhelming. And so being able to get thorough education about not just breastfeeding, postpartum depression, which is something significantly a lot of women go through, but it's not talked about. And oftentimes you don't know until you're in it deep, So I would just say that just with centering the model of care, just has been proven among women, but Black women especially, to reduce those rates. And our organization is very unique, I think, to a lot of organizations in the US. We're really fortunate to have a lot of grant programs and a lot of partnerships within the community. So we're able to incentivize our patients pretty significantly. They pretty much have almost everything that they need by the end of the pregnancy just by doing centering. So they get car seat, stroller, pack and play, 500 diapers, breast pump. They get a home delivery food prescription for about 8 weeks. They get a birthing ball, a postpartum kit, peri bottle. So you name it, it's they're loaded, So I would just say that piece in regards to centering and why it's important for the Black community being a part of that.
Oh, great. Thank you. And then recently, there's been a lot of Medicaid expansion within Maryland and in Virginia to look to encouraging like recompensation for midwives as well as for doula care. And so I really want Ebony first to say like the name of the practice that you're with, and if there's anything that last parting thoughts before we wrap up.
Yeah, you really read my mind because that is exactly what I was going to talk about, the money, right? So we know on average a hospital vaginal delivery will run between $8,000 to $9,000. If you add an epidural, that takes it up to about 12,000. Okay, if you go for a C-section, you're now in the 23,000 somewhere. We're able to offer, you know, the same prenatal schedule, right? Every 4 weeks, then every 2 weeks, and every week. Routinely 1-hour visits for a new OB, 30-minute visits for a return OB appointment, a 1-day, obviously the birth, right? The entire birth with one-on-one care. And we know sometimes with first-time moms that can go for 24 hours. We offer an in-home postpartum visit, 1 hour with the midwife, and then a second in-home postpartum visit with the birth assistant who has a lot of, you know, medical training, sort of like a labor and delivery nurse, within the first 3 days. And then we offer a 2-week visit, a 6-week visit, and then a 6-month visit. And we do all of that for roughly $5,500.
Oh, wow.
So why is there the issue of our practice being reimbursed at the same levels that the hospital practices are being reimbursed? So what's really needed is the public to be informed and to really understand why we have to really research. You know, when we're having babies, we're deciding to have babies, do your research, but also learn how to exert power. Exert your power on your politicians, require them to exert their influence on the insurance companies so that, you know, midwives like our practice, we're busy in the trenches doing the work. We don't have the manpower to be on the phone with insurance companies, especially when their goal and their motive is to deny as many claims as possible. You know, and so unfortunately, because of that, you have a lot of home birth and out of hospital midwives that aren't even taking insurances.
Yeah.
So you end up more so being able to serve a well-to-do population. So we are one of the few in the area that actually take insurances, even though sometimes we only get reimbursed $2,000 for a birth, you know? But we do it, and we've been doing it for 35 years for the love of it. We're very thankful for the Affordable Care Act and all of the changes that have been made to, you know, get us paid more, but we still have a lot more work to do so that we can start to offer our services to, you know, clients that are on Medicaid and still keep, you know, the lights on and keep the midwives, you know, getting some sort of a decent salary. So that's the next level, is just, you know, raising awareness and figuring out how the public can exert that influence onto the insurance company so they can really expand access so that, you know, whether a woman is making $100,000 or $30,000, if she wants to have a home birth with a nurse midwife, or any midwife, she should be able to do that and have it paid for.
Thank you, Ebony. And then Allison, I appreciate your work as a birth justice worker. Tell us again the name of how our community can find you, and if there's any other last parting thoughts.
So you can find me at letsdoulathisllc.com. I help families, I support families, I also support doulas and other birth workers. Because a lot of times we go through training and we just need a little bit more support to be confident to give to our clients what it is that they deserve, and the love and the nurturing and the care that they deserve. And I truly believe that if you can impact one family, you're impacting the world. And maternal health is our community's best shot and our country's best shot at being as healthy and as whole and as profitable as it's all connected. We've talked about how taking care of your family takes care of your business and takes care of the country, and it's all connected. So maternal health is not just an isolated individual's fight for their birth. It works for everybody. If we're taking care of the community, we're taking care of mothers, we're taking care of families, think of the global citizens we're creating. Think of the impact that we're having on the world. And we're doing, I thank you for allowing me to be on this panel with such great women doing such great things. And I agree with Ebony. The biggest thing we have is our resources. And all of us are resources. You have ways to connect with us and we can get you to where you need to go. But one thing, especially in the Black community, is, our information. We've always been a storytelling people. Share those stories. Tell your stories, because your story may look different from someone else's, but it can encourage them in a moment, because we're all doing this together. It truly does take a village. And while we're talking about gifts and things for baby, don't forget support for baby. Maybe mom does need those diapers, but she might not need those new Jordans because she needs postpartum support. She might need postpartum therapy. She might need someone to come in and just help to get her in a routine before going back to work. So, I think getting our research and getting into our information, knowing our voices and not being afraid to use them when necessary, those are the big things that I think are takeaways. And it's okay if there's something you don't know. There is no shame in saying, I just need a little bit more support and I need a little bit more information to make this decision that impacts my family and impacts the world around me. So I am honored to be on this panel with you all.
Oh,
Thank
no,
you so much.
I'm so glad that you answered the call. And then, and then Bookie, any last parting thoughts?
Okay, breastfeeding is very good for babies. It's very good for the mothers, and that's why we're here. We're talking about Black maternal health. But those babies that are being breastfed, remember they are going to be the mothers of tomorrow. The babies are going to be the fathers of tomorrow. So we're talking of the future of maternal health, the future of paternal health. So we're feeding the next generation. So let's look at breastfeeding as not just good for us now. Let's look at what goes on after us. And also, I want to use this opportunity to pass the message that people should look at the WIC program, not just as a source of formula. Yes, we give the formula, but I want us to be looked at as the big advocacy group regarding breastfeeding, that we are supportive of breastfeeding and we have all the tools and resources to assist mothers, to educate mothers to breastfeed to their maximum potential. Thank you very much for inviting me to the panel.
No, absolutely. And thank you for telling us about WIC, because definitely I think the misconception about WIC is that it's only for formula, but there's so many support systems that are built into that structure, and we want to make sure we utilize all of you guys. I want to take this opportunity to answer some questions that we got from our Facebook post. We got some questions about midwives delivering in Howard County and drug screen. And so we do have midwives that often are incorporated into bigger practices. So definitely check with your provider to see if that's an option that's available to you. It wasn't quite clear talking to Howard County. I think they have some midwives or staff and they're looking to expand that access, whether independent midwives deliver at Howard County. In terms of drug screening during hospital visits, that is a conversation that should be had upon admission to the hospital in terms of the lab testing that's done. So please feel comfortable and advocate for yourself to ask what exactly labs are being drawn and what tests are being performed so that you're informed that any additional tests are being performed on you. Resources to highlight for pregnant families and new parents in Howard County. We do have Howard County WIC. We have a great advocate with that and with Bookie. We have home visiting programs through Howard County Office of Children and Families, and there's new mom support groups, and there's also other abundance of resources that you can find listed at that website below. Again, I want to take this time to thank my beautiful panelists who all came together to really be representatives of this birth justice movement, which is really an opportunity to recognize, allow birthing people to recognize their innate power to make the best health decisions for themselves and their families. during all stages of pregnancy, birth, and the post birth period, and understand that this power is has a transformational impact on their families and their communities. I want to thank every one of you here for allowing equitable access to diverse birthing practices and also living in your purpose. Thank you again for showing up today and always for your patience in our community. And I also want to give a shout out to my accomplice and ally today, Erin Anderson. A lot of this would not be possible if she didn't make the phone calls and was here flipping through slides and allowing us to speak in our passion. So I want to make sure I acknowledge Erin today. And thank you again. Thank you for all the work that you do. I can't say enough about just how you give back to your community. And I think our community is better for having you as part of that movement and part of their tribe and community. So thank you very much. And this is our conclusion of our panel discussion for Black Maternal Health Week.
Thank you.
Thank you.
Thank you.